Good morning, everyone. It's an absolute pleasure to be asked to join you this morning. So the title of my presentation is Getting the Most from Your Healthcare Team. I'm giving this presentation from a district general hospital approach. Obviously, there's an awful lot of people in the room here. Not all of you will be treated in a large teaching hospital, so I'm just providing this from a DGH perspective. So let me introduce you to the team in Bath. We are led by Sarah Wexler, who's a consultant haematologist. She's one of 6 consultants. Within the smaller setting, our consultants like to subspecialise. It ensures that patients have better care. They can keep more up to date with current practice, so we feel it's very important. When you come to clinic, you may see a specialist registrar, and then the nurse specialist is myself and my colleague Sue Coppin. We both have been working with patients with MPN for many years now. We also are lucky enough to have a specialist pharmacist who works within the team. And the 3 of us all have a specialist interest in MPNs, and we run a telephone clinic and have been doing so for a number of years, which is a particularly successful way of running things for our patient group. So just to take a sideline, I don't know if many of you know Bath. It covers a large community area. We cover Somerset, well, some areas of Somerset, Bath and North East Somerset mainly, Wiltshire and South Gloss. So we cover a large catchment area of about 500,000. Obviously, that's probably a lot smaller than some of my colleagues' catchment areas and number of patients, but it's a big rural area. We have support workers that work within our Macmillan Information and Support Centre, and they're often people that you would see when you came to clinic. If you had a problem, you may go to our information centre. So we're very lucky that we now have those patients in post. And sadly, we are reliant on charitable funds for those workers. We have a clinical psychologist. We have one for the whole hospital. He doesn't provide enough support for us because he just physically can't, but he is there and he's invaluable. We have a haematology multidisciplinary team, and I'll talk a little bit more about multidisciplinary teams and what that means. And every new patient is presented at a multidisciplinary team, and cases are discussed and treatment plans are decided. And then we have our haematology day unit, which is where you would go if you were having a venesection, unless we could provide that service in the community, which we now can, thankfully, for some of our patients. So I thought it might be quite good to just go back to the very starting point and what you as a patient can do when you are originally referred. So if we refer to NHS UK websites, when you're choosing a hospital consultant, when your GP makes that referral, you often have the right to choose where you go. However, this is not like having a hip replacement. What you have is a rare disorder, neoplasm, whatever term you like to use, and it's probably really important that you go to where your specialist services are. So sadly, that does mean that you need to travel, but I think as we go through the day and we hear other speakers, it's important to know that you have the right person looking after you and you can trust them. Interestingly, just as an extra, you don't have a right to choose if you need emergency treatment, if you're in the armed forces, if you're accessing maternity service, if you're detained under Mental Health Act, or if you are on a temporary release from prison. I just added those because I was not aware really of all those choices. So getting the most from your healthcare team, let's look at effective multidisciplinary approaches. And I've listed here the diagnosis. This is what is on the England NHS website. And it's important to just go through this. So a multidisciplinary approach involves drawing appropriately from the multiple disciplines to explore problems outside of normal boundaries and reach solutions based on a new understanding of complex situations. The multidisciplinary working that we in clinic go on and on and on about, what that actually means is that you're going to have, it's going to utilise knowledge, skills and best practice from multiple disciplines. So in Bath, our multidisciplinary team will include the consultants, the registrars, the junior doctors, the nurse specialists, a histopathologist and a radiologist. And we sit down together every week and go through all our patients. So I thought when I was preparing this, I thought, let's see what actually is out there. So I looked on Macmillan's website and found some interesting things. A lot of this you're going to think is obvious, but I think it's really important when you're looking at making the most of your healthcare team, what you are actually entitled to. So they said, talking to your healthcare team may help. Many people feel better and more in control when they know what is happening to them and why. Very obvious, but actually just remember that you have that right to ask, you have that right to question, and it's really, really important. People often feel that hospital staff are too busy to answer their questions, but it's important for you to understand what's happening and how the cancer and its treatment is likely to affect you. The staff should be willing to make time for your questions. Your family and friends may also have questions to ask. Your healthcare team should be happy to answer their questions if they have your permission. They can also give your family and friends on advice how they can care for you. So remember, when you come to clinic, we are looking after you and your next and the person with you, be it your friend, be it your beloved, whatever. We are here to provide. The thing that I wanted to pick out about that is there was a point about time. We are so restricted by time within the NHS. I put on the TV this morning and there was something on the news, a criticism about the NHS. That's a daily thing. This is the problem. We try and offer the best care possible, but we have limited clinic times, and I'm going to go on to talk about how you can make the most of your time. But just remember that when you are in that room with us, you are the most important person. You have our undivided attention. But very sadly, when that door opens and you go out, the next person comes in. So we are restricted by time. And certainly in Bath, we have a number of consultants who are notoriously terrible at their timekeeping because they give so much whilst you're in that room that actually the next person's going to be late and late and late. And that's how it goes, and we can only apologise. Again, whilst I was looking at preparing my presentation, I found some information about the Point of Care Foundation, and I've put the website up there. It's very, very interesting. So I'll tell you about what they do, and then I'll tell you where it originates from. So their vision is a radical improvement in the way we care and are cared for. Their mission is to humanise healthcare. I thought that's really, really important. And they achieve this by working to improve patients' experience of care and increase support for the staff who work with them. And then their values are listed here. Innovative and inspirational, based on best evidence, independent and transparent, practical and supportive, and committed to what we do. So what the evidence tells us, we know that good experience of care for patients is associated with better clinical outcomes. We know that regulators know that patient-centred care improves outcomes. And we know that compassionate care leads to fewer complaints. So if we look a little bit more about the different programs, excuse me putting my glasses on for this. So let me just go back a bit to the Point of Care Foundation. So this grew out of a program which was developed by the King's Fund in 2007 to 2013. It became an independent charity in 2013, and it has continued to grow since publication of the Francis Report. Now, some of you may be aware of the Francis Report. It was all over the press. The Francis Report talked about shocking failings in patient care at the mid-staffs between 2005 and 2009. Healthcare is so transparent now. We have to look at what we do on a daily basis. We are assessed. We have people that come into our hospitals to ensure that we are doing the right thing. And this is really important. Now, What we can do as healthcare professionals is these 3 items up here. Now, again, the Sweeney programme, and this came from the Point of Care Foundation, this enables staff to step into patients' shoes and see care through their eyes, using tried, tested and effective tools and experiential techniques. What the programme does is it helps staff get as close to experiencing the patient's journey as possible. And this is through teaching, distance learning, mentoring and coaching. The Schwartz Rounds, now I've been involved in the Schwartz Rounds in Bath. What they mean, they provide a structured forum where staff from all disciplines come together and regularly discuss the emotional and social aspects of working in healthcare. So from a personal point of view, I was asked to join in a discussion about a patient who had myeloma, and the end of his life was very challenging because he and his family would not engage in palliative care in the hospice. They would not engage in it. That's their choice. As a healthcare professional, I felt that I'd let this chap down because I think the end of his life could have been so much nicer. That's a wishy-washy word, but I just felt that we could have done more. And I discussed that, as did my consultant from her perspective, in a forum like this where we had all different disciplines. And it made me feel as if I hadn't failed. In the end, I went away thinking, no, I did the best for this patient. I did what he wanted. But it was a really good, open forum environment to discuss these things. And these are happening all over the country now. Clinical supervision is something that's been around for years as well, where staff have the opportunity either in a group or on a one-to-one to talk through their issues. And I think that if you are dealing with healthcare professionals who are able to identify their own issues, their own challenges at looking after the patient group, you hopefully will have somebody who provides you with a lot more compassion and support. So this is all very positive from a healthcare professional point of view. So when we look at MPM Voice and we look at the website and we look at how we can communicate with the healthcare team. So the advice that they put on their website is the advice that I give to patients on a daily basis. Come prepared to your clinic. Write down a list of questions. I love it when somebody comes in with a piece of paper and says, I've got questions, because it means that they are prepared. We're going to hopefully answer all those questions. Often it means that we end up with loads more, but that doesn't matter. So bring a list of questions. Discuss your symptoms honestly. It's really important that you come in and you tell us, because we are seeing you in our environment. We're not seeing you in your environment. So discuss your symptoms honestly. Know your goals, know what you want out of your clinic appointment and what you want out of your treatment. Double check your understanding. So if you're not really sure, you're a bit embarrassed to ask, don't, just ask us. I would always encourage you to bring somebody with you, another pair of ears. Seek a second or a third opinion regarding your condition. We are a district general hospital, we refer. My consultants are often contacting Claire Harrison, asking her advice. We don't know it all, and we're happy to ask. Listen to all advice objectively and understand what is involved. Ask them to slow down. Ask for a drawing. Ask for a graph. We have a system on our when we're looking at blood results where I can graph them. I love doing that because it helps me explain, to have something I can show and I can say, look at these curves, they're all going the right way. Do express your feelings, do tell us. Ask for a summary. You will all have a clinic letter when you leave. A letter will be dictated to your GP. A copy of that letter will come to you. Don't be afraid to ring up and ask a question if you don't understand, because it's going to be in medical speak, and to be honest, it's like it's hard to understand sometimes. And don't be afraid to check the internet and libraries, but I would always recommend, talk to your nurse specialist, find out what they recommend. And you will find, MPM Voice, as we've said, is being checked by healthcare professionals. It's going to be the right information. And most importantly, make the choices that suit you. It is really, really important that they suit you and you are happy and you are confident in them. So treatment decisions to be made with your healthcare teams and family personal support networks. So apologies if it's a little bit small, the writing. I was quite proud of myself to even make something like this, but I didn't realise it was going to be so small. So consider your concerns, understand your emotions, consider barriers and challenges, take care of your overall health, consider your personal situation, and get a second opinion if you want. All of these things are incredibly important. So my conclusion, teamwork. It's all about teamwork. It's all about teamwork from a healthcare professional point of view. It's all about teamwork from a patient point of view. Build relationships and trust. You may not like that first doctor you see. You may not like your nurse specialist. Try and build a rapport and a relationship with that person, because we're in it for the long haul. Patients should try and achieve an acceptance and move forward as you are living with an MPN. Very easy for me to say that. And it may not be the sort of acceptance and the way you want to live your life, but I would strongly encourage you to try and find some sort of acceptance in all of this. Never be afraid to ask questions and challenge decisions. We don't know it all, we just try to. Pick up the phone and ask, or email your nurse specialist or whatever. Don't be afraid to contact them. And finally, it's all about teamwork. Thank you.